We have 3 boys. Kajir Betts, 17, Jair Betts, 13, Samir Betts is 10.
Kai, outgoing, definitely sports. And he played for AAU, so he was constantly on the go, you know, and it was, yeah.
Just, all-around athlete, I'm telling you.
Yeah, he really was.
He was really good.
He really was.
November 11th, it was a cloudy day, very rainy outside. I came home from work. I picked my 2 boys up from Boys and Girls Club. On the way here, Kai rode the bus home. So we got here and he asked me, he was like, hey, can I go and hang with some friends for a little while down the street? That's it. I said, all right, well, sure. I went to my neighbor's house, ordered some lamb chops from up the street, went up to the street to get the lamb chops and went back to my neighbor's house and got a phone call from her about the crash.
The driver of the car called me off of Kai's phone. Oh, we need you here, come quick. We're in a bad accident and Kai's not moving.
So I headed from here to the crash site. I think I was maybe second or third car on the scene. So when I walk up, I see the car totally destroyed. I'm asking him where he's at. He's laying in the ditch, all mangled up. Saw all of it. So I was there with him until the ambulance came, just trying to talk to him, kind of keep him alert, you know, just so much going on.
I remember leaving from the station here at Kilmarnock and going to Auckland Road. And then while we were on our way, we were getting updates from some of the people that were on scene, whether it's people that were calling or some people that had radios, because there was a couple volunteer firefighters that got on scene first. They identified that the patient had a severe laceration. And so in my mind, I started working through like stopping the bleed and going through that process. So I think I was in the back of the truck. I grabbed like tourniquet.
It was dark when we got there. It was just at sunset. It was just around like 6 p.m.
Like the people on scene, I think his dad, some bystanders, and maybe some occupants of the vehicle stated that he was ejected from the vehicle into the tree line and that he had crawled himself out to the roadside. And so when we found him and identified the large injury to his leg and attempted the tourniquet was unsuccessful, and seeing the open wound and also debris that he had crawled through and was in the actual wound site.
I tried to ask Kai some questions. He wasn't quite oriented enough to answer the questions. He was more kind of yelling out, but at least he was able to tell Alex like where his main injury was, where his main pain was. He did have a patent airway, so, but I still knew he was very critical and that we needed to get him out.
When we got there, I got an initial report from Alex and Jamie. It was an obviously serious call, significant damage to the vehicle. We believed the guy had been ejected. So Jamie had me call for life evac.
We were weathered in for the day here at the Life Evac 3 base, and we had a assigned AMR truck here for us to use if needed. We were listening to the scanners online and heard Lancaster dispatched out to a car crash, and they soon after their dispatch had requested a helicopter, which we heard and knew we weren't going to be able to respond.
I was focused on his mainly circulation, massive hemorrhage due to the injury. Like I observed when I finally removed all of his clothing, I saw the injury was basically from like his right hip all the way through his groin to his perineum. It was a massive laceration that exposed his upper quad. So working that and keeping pressure, I could actually see the difference in his perfusion when I was actually applying pressure. He'd be bleeding from his smaller lacerations as opposed to when no pressure was applied, he'd go ashen white.
We did leave an ambulance there. With the extent of his injuries, we needed as many hands as we could get. Everybody having different roles. I ended up maintaining his airway at one point. He had a free-floating jaw, and he was starting to become somewhat combative due to his head injury. So I was also talking to him, trying to keep him calm, just reassuring him that we were there to help him. Then I ended up getting out of the ambulance and driving them to the hospital.
25 minutes later, we heard them marking en route to Rap General, and the stress in their voice was, you could hear it. We knew it was bad. It sounded like it was a teenager of sorts. So we had a quick decision to make. We could either wait for Rappahannock General to reach out to us on the second attempt to fly the patient, or we could reach out to them and say, hey, we can come by ground now. Rappahannock General said, come on, bring them on. So we immediately got our stuff off the helicopter into the ambulance, and headed that way, thankfully, because Kai definitely needed to be at a trauma center as quick as he could.
It was extremely bad weather that night and our hear radio system had gone down. So not many details, couldn't get any report from the ambulance, and they just came in pouring rain, just hot and heavy. I met one of the squads out there.
I know by the grace of goodness that when we got there, it was actually shift change for the hospital.
Seeing that second shift come in was like, it was God. It was like, thank you, God. There's more people.
So within 45 minutes, we're at Rappahannock General, and once we get in there, there's so much already being done. They have already done so many things and therapies, but I just remember thinking there's still so much left to do. You know, he is still bleeding. He's still actively hemorrhaging. You can see it on the floor. It was hard to pinpoint exactly where that blood was coming from. So my first job was to control the hemorrhage, where David was to take an overarching view of exactly what was going on, the resuscitation that was needed. Our mentality switched from that of transport, getting Kai into an ambulance, take him to a tertiary care center, to that of resuscitation, remaining in place and making sure that he was maximized and optimized to survive the transport. And we still have quite a bit of work to do.
I remember somebody coming up to us and saying, hey, we can't stop the bleeding in his leg. Can you help us? And that's where Garrett picked up and went right to that location, because you got to stop the bleed. We can't fix anything from there. Unfortunately, what we did see was a very broken child. He had an open fracture of his face. He had a dislocation fracture, I believe, of his right arm and elbow. His right femur was broke. And the trauma from hitting something on the way out of that car had done multiple lacerations across the femoral area, which was complicating the ability to stop the bleeding. You can't just put a tourniquet there. Kai was in a rough state. I think our first blood pressure on our monitor was like 40/20, which is essentially nothing.
You know, this was a bleed that was fairly extensive and had been bleeding for a while. And with his blood pressure, I remember just being surprised as far as still the amount of blood still coming out of Kai's leg. I was able to try to isolate exactly where the bleeding was coming from, but there was already so much gauze that they had currently placed on it that were completely soaked through. In that scenario, I actually had to remove that gauze, get down to the bare injury, and we actually start using a hemostatic agent, hemostatic gauze, to start packing that injury. So luckily I was able to identify with my finger exactly where it was bleeding, stop that bleeding on a large vessel, and then continue to pack it with hemostatic gauze. And what that does chemically is helps us build up platelets and build up essentially a scab to help us prevent any further bleeding. And after about 10 minutes, I feel like we had a good handle on that, so we were able to tape it up, put some pressure bandage on it. After we began to resuscitate, we didn't have to watch the blood that was leaving from the bag going into Kai, coming right out of Kai. You know, it was actually going where it was supposed to be, perfusing his brain, perfusing his heart. That was actually the first time that I remember thinking, like, we might actually have a real shot, is just seeing him move when we were able to perfuse his brain, when we were able to stop the bleeding, to see him make purposeful movement. That was great to see. Obviously, we're not out of the woods. He's in very critical condition. It's 50-50 at best. I mean, probably at best.
Once we saw that stabilization, we knew we could actually start to think about packing him up for our trip. So about 10 or 15 minutes out from VCU downtown, we did make a phone call just to provide some updated vital signs.
Initially, he came in as a Delta trauma alert. The team brought him in from Life Evac, and immediately it was clear he was in a critical situation. He was bleeding significantly, and while the team was identifying the injuries and identifying what was needed to stabilize him, he was already behind in the resuscitation process. And so my role specifically in Kai's case was to get him the blood that he needed. And so using a rapid infuser, I assisted in giving him as many as 3 or 4 units of blood in a span of 10 to 12 minutes to help stabilize him before he was transferred up to the OR.
When we got to the operating room, we were all moving extremely quickly. Usually we obviously move a patient from the gurney onto the operating room table, but Kai was so unstable that his blood pressure dropped and he had massive amount of bleeding occur again despite holding pressure. So I ended up saying we just need to operate on the gurney. We first looked at his leg and got proximal and distal control of one of the main blood vessels that goes in his leg. And then we were able to get better control of the bleeding. While we were operating, I noted a massive amount of injury to his leg, which was a degloving injury. So all of his skin, especially on the front part of his leg, was just gone and sheared off. There was sand, rocks, twigs, leaves all throughout his leg, which plays a role in the future care he had because he had a massive infection in his leg. I never felt really great about where we were with Kai overnight because he was just so sick and there were so many possibilities for him to go backwards. I checked on him a lot overnight, and I do remember talking to his family, and he had a really big family, but I had a really hard conversation with them, and I said, he's okay right now, but he's really sick and he could die.
It's just that was it. And me and
The
Tony,
first night.
The first night, and we just like, oh my God.
When a patient leaves the operating room, when one of our trauma patients comes up to the intensive care unit, the surgical care is hopefully, if not complete, it is at least temporized so that the patient can live to fight another day. The rest of the care then kind of falls to the ICU team. So it's essentially everything comes to the ICU team. So managing his ventilator, helping to manage his dialysis that he ultimately needed, further blood product resuscitation, managing his cardiac function, assessing his neurologic status and intervening upon that. Because the goal is then to stabilize him enough to be in a better position so that when he can then return to the operating room, he will be able to get a more definitive operation rather than a damage control operation.
He wasn't oxygenating well, and that was immediately apparent. The first call I took were some critical values. His troponins were elevated quite high for a young guy. We knew that something needed to shift, something needed to change. One thing that the respiratory therapist did start was nitric oxide to help with oxygenation. And so that came into the room pretty immediately and rapidly improved his oxygenation at that time.
The injuries that Kai had that were significant to their surgery were pretty terrible skull base fractures and ligament injuries where the skull joins the spine. Upon recognition of that injury, the first thing that we have to do is alert the staff, right? Because his head's not really well connected to his spine.
Kai also had a terrible triad. So essentially he had a proximal ulna fracture, so the top of his ulna was fractured. And because of that, that was allowing his radial head to pop out too. So he essentially had a fracture dislocation of his elbow. Because of everything going on, that was just closed reduced until we could get him back to the operating room to stabilize that. Subsequently, he's required more surgeries on that arm.
When he was initially in the intensive care unit, his oxygen levels were so low that he was actually not delivering enough oxygen to his brain. In that time, between his hemorrhage and his hypoxia, he developed a hypoxic injury to his brain. And so there was about a week and change period where his brain was so unstable that going to the operating room to try to further address his leg was impossible.
The way we end up stabilizing this is you put a plate onto the occipital bone, the back of the skull, with screws into the occipital bone. That will sort of grasp the back of the skull, And then you're gonna find fixation points at C1, C2, C3, C4.
When he started to finally wake up and his hemorrhage seemed controlled and his brain seemed to be working better and he had stabilized enough that we could start addressing his leg, he developed a very aggressive infection within this open wound that also had broken bones within it, with this fungus that's called mucormycosis. And it's a fungus that is incredibly aggressive, and it only attacks the people that are weakest.
We had got through the neck surgery, we had got through the elbow surgery, jaw was wide shut, and that leg was just the last piece of the puzzle.
His leg ultimately was not salvageable. And the infection from that leg started causing him to have organ failure of some of his other organs. We had to make the decision to amputate his leg because of that.
He said the best thing for him to be able to be mobile is to, proceed with the amputation. So of course, okay, so that's a lot. We talked with Kai first, and then Dr. Sadler came in and talked to him. And the turning point for, kind of letting us know that everything was gonna be okay was when Dr. Sadler told him that, he reached up and shook his hand like a man, like telling him you're gonna take his leg. And I mean, I could tell it did something to us and Dr. Sadler.
Like, it was a breathtaking
It
moment.
was like, whoo.
Everybody had to stop and
pause, yeah.
Even Dr. Sadler had to get his stuff together, because none of us were expecting him for that response.
Yeah.
After his leg and the infection there was addressed, he seemed to then finally stabilize out. And then that was kind of the main point where it started to be the long road to recovery for him.
So I think the benefit of coming to a level 1 trauma center is that we are truly so used to seeing these high-level mechanism of injuries, and it has a true multidisciplinary approach, whether it's the trauma surgeons or the orthopedic surgeons, and if they need help with soft tissue covers, the plastic surgeons are here. And in addition, you have all the other staff members such as physical therapy, occupational therapy, nutritionists, all these people who are really important to a patient's well-being and for them to get all the care that they need to succeed in their recovery.
So I was with Kai for about 8 weeks from start to finish, and we really wanted to figure out some way for him to communicate, and that at first was just very basic, thumbs up, thumbs down, and then working towards being able to tolerate that passing mirror valve, and then going from just being allowed to have little sips of water. Again, he couldn't have ice because he couldn't chew with his jaw being wired shut, to then completing a swallow study that showed that his swallow function was remarkably intact. So we went from just sips of water to full-on meals, and then from being able to tolerate the passing mirror valve for 5 to 10 minutes at a time to then going on it for the whole day that he was awake. He could wear it.
While we were in the ICU, my goal with him was just to kind of get him through all the OR trips and make sure that we were still feeding him, giving him the adequate nutrition to get him from day to day in the ICU, to get him through dialysis and the trach and the feeding tube. But then everything took a turn for me once he came out of the ICU. You started to see that spark of a normal kid again. And so, he was cleared for a pureed diet.
He was eager for mashed potatoes. So once he got to that stage of mashed potatoes, that's all he wanted.
When Kai came in to Sheltering Arms initially, he was actually really high level. He was at what we call a minimal assistance level, just needing a little bit of assistance and supervision. Our initial goals were just to get him as independent as possible to go home with his mother in a safe environment and make sure he had all of the medical equipment he needed, and then jumpstart his prosthetic journey with his leg, and then I immediately focused on his right arm.
When we get patients from VCU, it's always comforting. You can trust that the individuals who were caring for them beforehand were doing their jobs.
Kai wanted to cook pork chops, and I didn't have too much of a heads up. It was like a day, and he wanted to surprise his mom when she came. And I was looking at the lack of pork chops we had, his right broken arm, and the amputation, and the kitchen that we had, which isn't exactly always wheelchair accessible. So I worked with the kitchen staff, and they were amazing at getting those pork chops to us. They made it work out. And then when we got into the kitchen that we were cooking in, he naturally just overcame the barriers. With what he was learning in other therapies, he was able to make the most amazing smelling pork chops I've ever seen come through SAI.
I'm so proud that he not once gave up. He never had a bad day. He never showed me a day where it was like, you know what, I don't want to do anything. Every day was, I'm gonna do it better. I'm gonna do it better. I'm gonna do it better.
Kai walks in wearing a Boys and Girls Club shirt, and I said, oh, cool shirt. He says, yeah, I work there now. And that made my day, just knowing that he found a place to be effective. He has such energy that someone needs to know him.
I still sometimes walk by the room he was in the intensive care unit and think about him. Like, it's seared into my mind. Obviously, I'm happy he had a good outcome at the end of it. It's brings me back.
The benefits of a level 1 trauma center are being able to have your child again. I mean, if it wasn't for them,
I wouldn't be here.
He wouldn't be here.
Thank you. Thank you from the bottom of our hearts.